Hello, it's Dr. Rhonda Johnson. Today is Tuesday, September 13th, 2022. Today I'm talking about safety of the Pfizer and Moderna COVID-19 vaccines in children 6 months to 5 years of age. Well, according to the CDC, nearly 1 million young children in the United States have received either the Pfizer or Moderna COVID-19 vaccine. Now, you may recall that it is recommended that all children between the ages of 6 months and up receive a COVID-19 vaccine. Well, there was an article published in the September 2nd, 2022 issue of the CDC's Morbidity Mortality Weekly Report on the safety of these vaccines. Now, the data comes from the VAERS and the vSafe database, and I'm providing a highly simplified summary. There's a lot of information in this report, so if you want more data, please see the reference. Well, first, more reactions were reported for children ages 6 months to 2 years than for the older children ages 3 to 5. Now, the most frequent side effect from both Pfizer and Moderna vaccines for this age group was irritability or crying, and mostly 1/2 of the children who reported adverse events in the age of 6 months to 2 years. Now, I will point out that irritability and crying is common for the routine childhood immunizations. Now, no events of myocarditis were reported to VAERS after vaccination in children ages 6 months to 5 years. I think that is very important. And among children ages 3 years and up, the most common reported reaction was pain at the site of the injection, and that's common even in adults. Now, among the VAERS reports, 98.1% of the post-vaccination events were classified as non-serious by the CDC experts, and 1.9% of the events were classified as serious. Now, vaccination errors, that means incorrect dosing, were among the most common events reported to VAERS in the 6 month to 5 year old age group. Unfortunately, no adverse event was associated with vaccination errors in 92% of these reports. Of the serious events, one included 8 reports of seizures. One child had a high fever and had a seizure, and 2 were in children with congenital brain malformations. Now, the authors noted the limitations to their findings. First, vSafe is a voluntary program, and it may not be representative of the whole entire vaccinated population of children 6 months to 5 years of age. Secondly, VAERS is a passive reporting system and is subject to underreporting and reporting biases, especially of non-serious events. Third, the Pfizer Dose 3 data were not available at the time they did this analysis, and their data findings were limited by the short surveillance period. They studied events from June to August 2022 and might change as safety monitoring continues and more doses are given to children ages 6 months to 5 years. But here is the key takeaway from the study, in my opinion. The authors of the study concluded that the initial vaccine safety monitoring in children ages 6 months to 5 years show that no unexpected safety concerns were detected. They recommended that health care providers and parents of young children should be advised that local reactions are expected after vaccination with COVID-19 and systemic reactions are expected, and serious adverse events are rare. Now, the CDC and FDA are going to continue to monitor the vaccine safety in the children 6 months to 5 years of age. So that's my message today. I think this is good news. Parents, do talk to your child's healthcare providers or pediatricians or whoever they see. If you have a 6 month to 5 year old child and you have been hesitating around the COVID-19 vaccines, at least this initial data shows that they're safe. I know parents are really concerned about long-term safety. So at least in the short term, after 1 million doses almost here in the United States, the vaccines are showing no safety signals as detected by the CDC researchers. Take care, folks. Be safe. And I hope that's helpful.